Dear students and my dear viewers, welcome back. In this session, we are going to discuss about introduction to anatomy for beginners. So the beginners includes the students who are entering into the healthcare professional courses, and also some of the students who want to brush up their anatomy basics. All comes under this beginners. Okay, in this session we are going to discuss about what do you mean by anatomy, what is the importance of anatomy, and what are the subdivisions of anatomy, and what are the approaches, and what is the standard anatomical position to study the human body. Okay, now we are going to see what do you mean by anatomy. Now, anatomy is the science that deals with structural arrangement of various components of an organ, tissue, or part of the body and is correlation with the function. Okay, the word anatomy is derived from Greek word called anatome, which means cutting up. Ana means up, tome means cutting. In Latin, this anatomy word is called as dissection. Okay, so if you see the terminology which are present in the human anatomy, most of the terms are derived from Greek, Latin and French. So you people should be familiar to these words. Okay, otherwise it is very tough to study the human anatomy. Okay, it will take some time, but a frequent studying of these terms, it is very easy to remember. Okay, and now cutting up cadaver, that is dead body, is one of the method by which study of structure of living things is made possible. Okay, and here the structure plays an important role in function. So here the anatomy is going to help to understand the structure of the human body, how the cells are arranged in a tissue, and how the parts of our body are arranged inside the body. Okay, how the design of the structure of the particular organ or a part of your body is present. All those things we can study in the anatomy. Okay, and which finally helps in the understanding of the function of that particular part or an organ. So if you take any part in the body which is different with the other one, okay, if you take eyes, the structure and design of eyes are different with that of the structure of an ear, for example. Okay, because the structure of the eyes are designed in such a way that which are used for seeing. Okay, whereas in the case of ears, which are useful to hear. So if you can't understand the structure, then you can't appreciate the function of that structure. Okay, here the anatomy mainly deals with the structural arrangement of various components which are present inside the body. Okay, now what is the importance of anatomy? So anatomy helps in the foundation for understanding health related fields. Okay, anatomy is the basis for understanding structure and function of the human body, and it helps in the application of anatomical knowledge which is required for understanding the clinical conditions, which finally helps in planning and interpreting laboratory investigations, and also for planning and undertaking treatment procedures. So these are the importance of anatomy. And if you take the subdivisions, it is mainly divided into three major divisions. One is macroscopic anatomy, microscopic anatomy, and the developmental anatomy. So macroscopic anatomy, in this anatomy we can study the structure of the organ with the help of our naked eyes. In the case of microscopic anatomy, we can use microscope to study the cells and tissues, how they are arranged inside an organ. Okay, and if you see the developmental anatomy, which helps to study the embryo. Okay, so the development of the embryo. And if you see the approaches for studying anatomy, there are mainly two types. One is region wise, and also another one is the system wise. Region wise means you can study head and neck as one part, limbs as another region, like upper limb and lower limbs comes as another region. And if you take trunk, okay, trunk includes thorax, abdomen, and pelvis. So these comes under region wise approach. And if you take the system wise, we can study as a whole, like one system. You can take circulatory system or excretory system, respiratory system as a whole. So you can study in that way under systemic type of approach. Okay, to study all these things, in the anatomy, so we should require a standard reference which is widely accepted in the world, that is called as anatomical position. So now we are going to discuss this anatomical position now. So this anatomical position helps to study the relationship of one body part to the other body part of the human body. Okay, and this anatomical position is described by imagining as if it is standing in an artificial posture, which is known as anatomical position, which is used as standard reference in medical profession. Whatever whatever region you have to study, you have to keep this region in the anatomical position only. So as a whole body, what is the anatomical position is imagined like. Okay, the person or the body should be placed like standing in erect position. So although we have different postures in standing, but all those standing postures are not considered as anatomical position. So the anatomical position is described in such a way that the person should be standing erect, okay, and both the feet close, okay, parallel to each other, flat on the ground, and if you see the toes are directed forwards. Okay, and if you see the arms are hanging by the side of the trunk. This is the trunk, by the side of the trunk, with the palms of the hand, very very important, with the palms of the hand facing forwards. If you see the fingers, these fingers are facing straight downwards. Head facing forwards. Eyes, if you see, the eyes are fixed on a distant point. This is the anatomical position. In the next session, we are going to discuss about some clinically important positions of the body. Thank you.